with audiology, it is a grad program. I grew up in Marathon, so really close to here, on a farm, graduated from Marathon High School. Started out here at the MC. So I started local and then did a year at UW Eau Claire and then finished up my undergrad at UW Sigmund Point, where I kind of fell into audiology and went to my doctorate through Point in Madison. So I'm really excited to have the opportunity to talk to you guys today about audiology, because when I was sitting in your shoes, I knew I wanted to do something medical, but I had no idea what I wanted to do. The thought of, doing bed baths or cleaning up blood and vomit and all that kind of stuff, surgery, made me kind of queasy, so I'm like, well, that's not going to work. So, and I didn't know that this was even an option. So I kind of fell into it with the undergrad program that I was in, and have never looked back. So it was a really good fit. So hopefully this will, kind of open you guys up to a different option. I am a very laid back presenter. So what I mean by that is, yes, I have a PowerPoint. I use it as a roadmap, but please, I welcome questions. I love questions throughout. So if something I say sparks a question, whether it's directly related to what I'm talking about or something completely off in left field, please ask. If you're like me and you wait, you're going to forget. And I know some of you guys will be leaving and coming. So ask so that you don't lose out on an opportunity, okay? I did bring a third-year graduate student with me too. Today is her last day with her clinical rotation with me this fall. So if you guys have questions about graduate school and kind of what it's like as a grad student in our program, she's a great person to kind of pick her brain about that too, because she's living it and breathing it right now. So we'll start with what I have here. So audiology, reconnecting people to the world around us. And our world around them. So that's kind of what we do in a nutshell, okay? So what are we going to talk about? I'm going to answer, what in the world is an audiologist? What do we do in audiology? We'll go into my scope of practice. I'll talk about the education, so what it takes to become a licensed audiologist. We'll go over the different settings or environments that you can work in audiology. I'll kind of go over a typical day in my work setting. Is going to be completely different in a different setting, whether it's a school or a university, but we'll kind of go over that. I'll go over some personality traits and characteristics that would maybe be a good fit. So if you're sitting in the back like, well, that's me, it might be really something for you guys to think about. And then benefits, or what I love about the field of audiology and my job, and then extra time for questions at the end. Okay? So the burning question, what is audiology? So audiology is the evaluation and treatment of hearing and balance disorders. So as an audiologist, I'm a hearing and balance specialist. Okay.
What do you mean by balance?
Balance, so patients that are chronically dizzy. It can be like true vertigo where it's like you're on a tilt-a-whirl and you can't get off. It can be they're off balance, they're falling, they're kind of walking like they've had too much drink. Or just like chronic lightheadedness. So, yeah, so it's, there's a lot that can be done for it. Most people don't realize this is where you go. Family practice doesn't really have an understanding of what dizziness and balance stuff is. So if you know somebody, send them our way, because that's what we specialize in. So one of the things, so if you hearing that definition, you probably think, oh, she's the one that puts the headphones on, makes me raise my hand for beeps, whips hearing aids on, yet you need them. That is, part of what I do. It's a very small part. But so one of the first things, audiological evaluations or hearing tests. So basically what we're doing when we put those headphones on is we're figuring out what type of hearing loss you have. So there's different types. Some can be treated with medicine or surgery. Others you need hearing aids. Okay. We're also finding the severity of the hearing loss. Is it affecting one ear, both ears? How is it affecting your communication? As well as the shape. So different shapes can lead to what caused the hearing loss. But also, like let's say they have a low frequency hearing loss here and it rises. That actually can be a precursor or an early indication of cardiovascular issues. So we can sometimes detect heart disease and some like blocked valves and all that kind of stuff before they're even on a cardiologist's radar. So it's kind of cool that we deal with all the medical systems in the body, just in a different way.
So is there a time frame? We should be going to the dentist every 6 months. We go to the eye doctor. Is there a time frame for getting your hearing tested?
I
just when you can't hear?
Well, That's when most people come, and usually 5 to 10 years after they know they can't hear. But I say, even like 18, you graduate from high school, you go get a hearing test for a baseline. And I say that because it happens more often than not. You can have a sudden onset hearing loss. So you can get, like you get a cold, you can get a virus that affects your inner ear and boom, your hearing's gone, or you have a significant drop. If you have that baseline for us to measure, then we know, is this truly a significant loss, or is it something that's just gradually been happening? But definitely by age 50, 55, you should go in for annual hearing tests. Most insurance companies cover it, so you might as well. And then, so the testing, this type of testing where you put the headphones on, that works for about, 4 years and up. But we can test within hours of birth. We have different tests. So just because we can't do the headphones for itty bitties, we have other tests that I will kind of tell you a little bit about that allows us to test patients any age, cognitively impaired, nonverbal, sensory issues, you name it, we can test the patient. So there's not one patient that we cannot test, which is really cool. So one of the other things one of the tests that we use is auditory brainstem response testing, which is super cool. We put electrodes on their forehead and behind their ears, present sounds, and we actually measure brain activity and measure brain waves. So if they're normal, the waves will be present. If it's not, we can actually do kind of like what we do for a hearing test and find how severe it is and fit hearing aids to this. So we do this for itty bitties that don't pass their hearing screenings. And the youngest I fit with hearing aids was 7 weeks. So it's a good approximation that we can fit babies that are born with hearing loss with hearing aids so that they develop speech normally. This test also allows us to identify like lesions along the brain and brainstem. So if they have tumors along the brain, the auditory pathway, we can identify that. So patients that can't do an MRI, or maybe they have a pacemaker, or they have metal, shunts and stuff in their head, we can do this test that will indicate, yes, in fact, there is something going on. And there's patients that have auditory neuropathy. So hearing's normal, but the nerves aren't firing in sync, so it's all garbled. This is the only test that we can identify that too. So, and then some audiologists will specialize in what we call intraoperative monitoring. So you actually go into the OR and when they're doing like facial nerve decompression and all like the brain surgeries, we do this test because if they get close to the auditory nerve, if they nick it, the person's deaf. So we see that wave kind of diminish and they go, oh, hold on, we gotta remove the scalpel, we're gonna do something we don't wanna do. So if you like the cool medical and wanna do more surgery stuff but don't wanna physically do the surgery, you can specialize in that, make buku dollars, and do something like that in the OR. So, and then there's otoacoustic emission. So your inner ear is super cool in that you have hair cells that detect sound. Well, if we present a series of sounds, they actually echo a signal back that we can record. So we can test patients, again, that can't respond, whether they're too little or, developmental issues. And this will detect even a mild loss. So it's pretty cool. We do this for patients, too, that maybe are on chemotherapy or head and neck radiation, because this will show an issue before it'll show up on a hearing test. So we can tell the oncologist, oh, do we have to potentially change their form of treatment. Then this video nystagmography is the balance test, one of the balance tests that we do, which allows us to evaluate both the central of the brain and brainstem and the inner ear balance system. So this information will tell us, do they need to go to physical therapy? Did something happen, wiped out their balance system, and now we just need to retrain the brain to function in your everyday environment? Is there something like maybe MS, or something going on that they really need to see neurology for? So they really rely on this testing for us to know what do we do next. We also evaluate tinnitus and can help perform management. Anybody here have ringing in the ears? That's essential. You do? Okay. Yeah. Have you had it a long time?
I've had it since about 13.
Okay. Do you have hearing loss?
It gets too quiet, and some places really quiet.
Okay. Is the ringing always there? Is it coming? Yeah. Yeah. It's kind of annoying, right? Yeah. We have
I
one in.
haven't seen anybody fight.
Okay. 1 in 5 patients complain of ringing in the ears. So we're trained in this so that we can actually do tests to find the pitch, the masking, and the loudness, and then we can provide rehab potentially for them. So tinnitus is it's a neurological response. So basically you hear a noise that's not really there. So there's not like a high-pitched buzz, you know, from some source that's causing it, but you perceive it in your head. It's a neurological response that given if it becomes constant or loud enough, it actually engages the limbic system. You guys know emotions, and patients can become very anxious, stressed out, and actually become suicidal. So our goal is to prevent it from getting to that point with these different rehab options for them. Very few audiologists work with this in depth, specialize in it. We're actually coming out, our clinic is going to start offering this therapy starting in the new year. So we're going to give options for patients. Right now, basically, there's not much you can do you can't get rid of it, but there's certain things, you know, if it's louder, right, you don't necessarily hear it. It's when it's quiet, and that's what you have to focus on. So now it's put a radio on, listen to the TV, stuff like that. Basically just try to distract your brain and ignore it. Now we have therapy options that can really help kind of change how the brain is perceiving that and dealing with it, and kind of remap the brain, which is kind of cool. Then we do hearing aids. So most of you probably picture this, your grandpa or great-grandpa with a thing that's big gaudy thing that's whistling like crazy. What? He can't hear you, right? Yeah, you know. Hearing aids have changed tremendously. Yes, we still have these models, but most are going to something like this that's behind the ear. This is rechargeable. It's also Bluetooth compatible. So if you have an iPhone or even now an Android, there are two Bluetooth wireless headsets. On your phone calls, stream your music, stream your podcasts, whatever you guys do on your phone, you can stream it. Nobody knows what's going on in there, only you can hear it. There's one hearing aid manufacturer out there now that has sensors in it. So it's almost like a Fitbit, but it's on your ears. So pulse. They have sensors for fall detection. So your grandma falls. It's linked to their phone, so it can call 911. They have a stroke. You know, they can say, "Are you okay?" They can shake their head. It links it and can tell the person on the other line, the dispatcher, "No, this person's probably can't function. We need help immediately." Or can link it to the daughter's phone. "Hey, your mom. It's showing that your mom fell. You might want to go check on her," which is super cool. So hearing aids are not what they used to be. I mean, and there's no age to them. As I said, I fit 7 weeks old with hearing aids. Now with all the veterans, you know, the people my age, even a little bit younger, going overseas, lots of people my age have hearing aids now. You know, there's, with the substance abuse and all that kind of stuff that's, you know, through the roof, that also affects the hearing.
So sidebar with that, not many in this class, but if you walk in our hallways, you will see a lot of kids with the earbuds and the hanging earbuds and whatever.
Yeah.
What's your thought as a professional? What's going to happen to these guys in the years to come here?
I am always going to have business. iPods or whatever you guys are listening to is fine if it's at a safe level. You know, if you're sitting there and your teacher can hear it across the room, or your mom can hear it from downstairs, which get reports of that, you're damaging your hearing. If you go to concerts and you stand next to the speaker, the last article I just read, 7 minutes next to a speaker at a concert, you have permanent hearing damage. Cranking the bass and the stereo in their cars. If I can hear, I have neighbors like doom, 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 I'm like, oh my God, that's giving me a headache and I'm in my house, but it's causing permanent loss. And, you know, I know kids, you know, little aunt think they're invincible, but once that hearing is because the hearing loss you guys are giving yourself is permanent. There's no way to fix it. So no surgery or medicine, so you would have to do hearing aids.
So what's the safe level? I mean, I know there's kids that walk by and you'll say hi to them, and they don't hear you. I mean, and you can't hear it, but it must be loud enough that, hey, how's it going? And they don't respond, so it must be to the point of that.
Yes. Yep. Or they're so distracted, you know, because of that and they're not focused. That could be part of it too, yeah.
Maybe that's the buds in there looking at yourself.
Yeah, that does it too. We also do boning for hearing aids. So that is this right here. So what that is, actually the ENT doc would implant a piece into their skull. The bone, what we call osseointegrates, or basically forms around it. And then we pop that device on and it vibrates the bones in your skull. So there are people that are born without an outer and a middle ear, or they have chronic drainage, chronic swimmer's ear. They can't do a traditional hearing aid. This is an option. Gives them access to sound, just a piece there that goes right and simulates that inner ear, that cochlea. So that's an option. And then we are going to start, and I thought I did on him, but it looks like I didn't, cochlear implants. So cochlear implants are patients that are either born profoundly deaf, or their hearing has progressed to a point where traditional hearing aids don't work. They can actually surgically implant an electrode in the inner ear and give them access to sound. So if you've seen the videos like on Facebook that are going around now, or YouTube, where the baby, the mom says, you know, I don't know, Henry, hi, I love you, and he smiles and mom's crying. I mean, it's cool. I mean, we can give access to patients that literally have never heard those words. So that's a huge specialty. There's not many surgeons that do it, but they do it in Madison, Milwaukee, and now Purvey and Green Bay. So our office over the next year or two is going to get trained so that we can actually activate. So those moments you see on Facebook and YouTube, the wow moments where everybody's crying, we'll actually be able to do it hands-on here in Wausau, which is cool. And then other things that we can do, so cerumen is another word for earwax. So we remove earwax all day, every day. But really, so some people are like, oh, that's disgusting. I love it. Sense of satisfaction, it's weird, I know. But really that's about as gross as you get. So if vomit disgusts you, if the thought of doing bed baths and everything's like, no. Really earwax is, you might get a draining ear from an outer ear infection, but wax is really all that we deal with. So it's a pretty clean, safe environment that way. CAPD, so Central Auditory Processing Testing. We can do that. So there's people that they hear normally, but they can't process sound, especially in noise. So we can evaluate kiddos for that are really struggling at school, and we don't know why. That's some testing we can do. Oral rehabilitation is basically our version of counseling. So if you love educating people and talking to people and helping them through things they're going for, but you don't want to be a psychologist, a psychiatrist, or counselor, we do a ton of that as an audiologist. So ototoxic monitoring is kind of what I touched on before. So patients that have chemotherapy, head and neck radiation, or some a really bad infection that they need heavy antibiotics, gentamicin, we'll monitor pre, post, and 6 months after, because a lot of them are what we call ototoxic, damage to hearing and our balance system. So there's a lot of places that team up really with the oncology team to come up with a protocol for that. And then hearing conservation is basically helping patients protect their ears, kind of like we were just talking about, before damage actually occurs. Because believe it or not, if we get a normal hearing test, we're cheering, because we don't see very many normal. So protect, okay? All right, so where can we work? We can do an ENT practice like where I work. So you're basically part of a medical team. So direct referral, which is awesome. ENT here in Wausau is the largest in north central Wisconsin. So we have 5 full-time ENTs, part-time ENT, 2 allergists, and 5 full-time audiologists and 1 PA. So huge team, direct referral. So you see a lot of medical cases every single day. You can do a private practice where you pretty much are just going to see adults and hearing aids at a private practice. A school district, so Wausau has an audiologist just for the Wausau School District. Others will work for what we call CISA, so they have several districts on the caseload, and they just travel, just school to school. You can work at a university. So if you don't want to do direct patient care, you can teach full-time, and oftentimes there's research involved and maybe some clinical supervision, but more focus is on the teaching and the research aspect. And then you could work for a hearing aid manufacturer, so right for the hearing aid companies. You can do sales, you can do research. You could work from the comfort of your own home in your yoga pants and old t-shirt with a headset on, be doing laundry, get a phone call from someone like me, help, the hearing aids won't connect, or what works with this. You answer the call, you go back to doing what you're doing. So if you want to work from home, that is an option. And you can do research. I don't think I said that. So you can research for manufacturers as well. And then armed forces. So you could do either VA, or every branch of the military is always looking for audiologists. The Air Force, when I graduated, was trying to recruit. The only reason I didn't do it is I would have gone to basic, and I just found out I was pregnant. And the thought of having to uproot my family, because they can transfer you anywhere. But let me tell you, the tuition reimbursement, the pay, and the retirement plan for working for the armed forces and government would have been well worth it had it been a different time in my life. So, the education. So, there's a lot that goes behind getting the letters behind your name. Okay, so if you know, yes, I want to do audiology, the smartest thing to do would go for, you need a 4-year degree, communicative sciences and disorders, or COMD for short. Okay, I listed all of the universities in Wisconsin that offer the COMD major. With an undergrad major, you can either do your master's in speech language pathology or your doctorate in audiology. Okay, if you decide, let's say, like, no, I want to do counseling, or I want to do social work, or I want to do something, I want to do accounting. You know, you can do that and be like, nah, I'm not loving that, I want to be an audiologist. You can, there's just a set of like COMD courses that you would have to take before you can apply. So you don't have to do like a 4-year bachelor's in COMD, but you have to get those full courses, like normal language development, basic audiology, hearing science, and some of the core ones that you really need in order to have a good background. Once you get your bachelor's, then you have to do a 4-year clinical doctorate of audiology. So this is 3 years of classwork with clinicals, so what Alana is doing right now. So she's working on finishing her 3rd year in the program. Your 4th year is basically equivalent to your residency in medical school. So it's 40 hours a week externship. Unlike an internship, which is paid, most externships aren't. There are some you can find, but I often caution students on taking those simply because sometimes you become more of a workhorse and like kind of doing the grunt work versus actually getting the full patient care if you're not getting paid. So you kind of become an employee for them. And then you have to present a capstone, which is basically you conduct your own research and you present it to all of your peers and all the audiology doctorate staff. And so, something I'll say as far as the bachelor's goes, whether you're going to go speech path, because that's what I went into. That was my major. I'm like, I'm not loving it. I was a senior. I'm like, shoot. Did I just waste 3 years of my life? Took basic audiology. I'm like, oh, this is what I need to do. So that's how I fell into it. But it's super, super, super competitive. So if it's something you're at all considering, A's. Have to get A's, A minuses, maybe B plus. You have to be involved in the, like, for that it would be NSHA, National Student Speech Language Hearing Association, which is a huge mouthful. But basically just, be involved. Because I know students that were involved. They were officers, they had straight A's, they were great, and they didn't get into a program. So definitely, if you know from the get-go, D's do not get speech therapy or audiology degrees. And I just warn you because it's easy to go to a 4-year and be like, oh, and get into the party, get into the I'm not going to go to class. This is not a major, which really any medical profession, I mean, you guys are in this class. If you at all want to do anything medicine, really, there is no room for that. Not that you can't have fun, enjoy. But just kind of be at the back of your head. All of these colleges too that I put on here, they do, if you wanted to do speech therapy, they do have master's programs. Okay, so there's a lot of programs in the state that do offer that degree. The collaborative between Madison and Point is the only one for a doctorate in Wisconsin. Okay. Point accepts about 6 a year, Madison 10 to 14 to get in. Okay. Once you have your doctorate, you have to take your praxis, which is written boards. And then depending on the state, which Wisconsin is included, you have to take a practical examination as well in order to get your license. So a typical day for me, so I don't arrive at 8 p.m. Sorry, that is a typo. No, so I start at 8. We'll have 5 to 7 patients in the morning, have an hour for lunch, 5 to 7 patients in the afternoon with some chart review time. The nice thing about my day is never the same. I might have a brainstem test in the morning where I'm seeing a 3-day-old baby that was just out of the hospital. Then I'll see a guy that's 96 that can't hear a darn thing and I'm getting him hearing aids. And then I see somebody that's got chronic fluid, and then I do a balance test. So it's variety. So if you're somebody that gets bored really easily, an ENT practice is a great fit. So who would be great as an audiologist? So if you're self-motivated, you're hardworking, because you're at a private practice, even at an ENT practice, you really are kind of on your own with your schedule. You know, the receptionist will get you on, but you really have to know how to budget your time too, because yes, you have your patients, but now you have hearing aids to order. You have repairs to do. You have a lot of stuff going on, and you have to be able to manage your time so that your patients don't suffer because you have to get your stuff done. And you have to be flexible. If you're somebody that if your day doesn't go quite exactly where you want it, your day is going to be ruined. This isn't the thing, because patients cancel. Patients get added on. You might think you're seeing somebody for a hearing test, and really it's a hearing aid eval, and you're like, okay, this is not at all what I was thinking I was in for. Enjoy working with people. I had put you need to like people, and then I had some people like, well, that's not true, I don't like people. I'm like, oh, so clearly you can provide good care and not thoroughly love people, but you need to enjoy working with them and have a true desire to want to help people. Because the bottom line with our profession is most people that come see us, they don't want to be seeing you. Nobody wants to have hearing loss. Nobody wants to be told that they need hearing aids. Or they're sick, they feel icky, they've had sinus, this, that going on. So you really have to have a passion for working with people and helping people, so you can get them on the level where they're ready to do something about their struggling or what they're struggling with. Good time management, kind of some reason I said before, work well in a team. So like I have 4 other audiologists, so I have a team of 5 that I manage, but we collaborate with ENTs. We collaborate with speech therapists, with OC Health, I've had to refer to psych. So really you have to be willing to go above and beyond for the patient. Critical thinker, and then somewhat organized, as my other student says. You know, you don't have to be completely type A label maker, but you gotta know how to organize things. Benefits to being an audiologist, one, it's really rewarding. You know, so while you have a lot of patients that are fighting, you know, that they don't want to fix what they're dealing with, when you have the kids that are, I just saw my favorite, I call her my star patient. I saw her this morning, and I fit her a year ago. When I saw this little girl a year ago, she was like 3. She had no speech, crazy sensory issues. You couldn't touch her. She had balance issues. I fit her with hearing aids this morning. She has 4-word sentences. She doesn't have to be non-health or occupational therapy anymore. Like, I mean, it's just, she comes in, Miss Melissa gives me a huge hug, and she's so excited, and I keep listening to her talk, and I'm like, holy moly. Like, that's why I do what I do. So, or the grandpa that says, I can finally hear my grandkids. I couldn't hear him, and now I can hear my grandson say, I love you. Like, maybe it doesn't sound like huge here, but if you see it, it's very rewarding. Structured hours. So it's 8 to 5. No nights, no weekends, no holidays, no on-call. Very few other medical professions can say you have set hours and you don't have to take off holidays. You don't have to worry about the nights, weekends, or taking call. So it is really nice. A variety, and what I mean, yes, my job is variety, but also, you know, they say, you know, I don't remember the exact statistic on how many times you change jobs or you change careers over your lifetime. Well, audiology, you go to school, yes, for a long time for a huge knowledge base, but let's say you start with patient care and you get 15 years in, but I'm going to go, I can't do this anymore. But so you could go work at a university to teach, or you could go work for the manufacturer, now all of a sudden you're sales, or you're marketing, or you're working from home. You don't have to completely reinvent the wheel and learn all this new information. You're using it, just in a completely different way. So that's nice. Very few professions allow for that as well. And it's not physically demanding in that you're not like on your feet for hours and hours and hours. You're not lifting, you know, super heavy where you're burning out your back and your neck and your arms and all that kind of stuff. For the last, I don't know, probably 10 years, audiology is always ranked in the top 10 for least stressful jobs. Some days I beg to differ. But, I mean, really, it's a good profession to come in to. Questions? guys are so darn quiet. Yeah,
Going back to that structure.
Yep.
Let's say someone gets in a accident and there's some damage to the skull, head, what, is there someone on call then, or do they just say, okay, we'll try to get you out, you know, get checked out later, or how does
yeah,
that work?
typically they would go to the ER and they'd be evaluated by EMT, to make sure there's nothing major going on. But then, as soon as if it's that bad of damage, they're in the hospital. But then we will evaluate once they're stable and once we can kind of swelling goes down. I mean, I've evaluated patients that still are in like the metal halo and stuff like that, if there's skull fractures and everything. But it's not super urgent, because chances are if there is something, we can't do anything until they're healed. And we know kind of what it's gonna be after swelling goes down and bleeding stops and all that good stuff, so. Did anybody know that I do all that? Does this sound like something that somebody might be interested in? Maybe. Maybe not. You're not gonna hurt my feelings if you say no. You? Yeah? Yeah, maybe. Yeah.
I didn't want to do it. I'll be honest. Like, when I went into college, I was like, yeah, no way, Jose, I'm not taking a physics course. That's not going to happen. And, like, hearing aids, how boring. Okay, I get that. But there's, like Dr. Sigmund was saying, because there are so many different avenues within audiology, that, like, if you are more of a math, science-y person and, like, you really like physics, hearing aids are right up your alley. Like, I would have had no idea. So just keep that in mind as you're exploring all of these different like talks that you guys are having, like with all these different speakers, all the different avenues within, and like how your skill set like could be beneficial, like useful in that.
I will say too, one of the things that, because I did start out pre-med, and no matter in high school and in college, chemistry, kicked my butt. No matter how hard I tried, I couldn't do it. And I had to take it, I muddled my way through it, but there was no, there's no organic chem, there's no microbiology, there's no calculus. So, like, I like science, and I like math, I love biology, but you're talking, like, all that intense chemistry and that intense math, it wasn't for me, and you don't have to do that with audiology. So.
Are there industries that come to you guys and say, okay, what can we do for our employees, for instance, like the paper mill, that constant hum, the sawmills? Do they come to you and ask for ideas, whatnot, to help protect their employees?
Yeah, and they work a lot with OSHA. OSHA comes in to do a lot of that. Sometimes we'll do like sound level meter monitoring for them, but we do a lot of all the paper mills and all the big places will either do their annual hearing tests, or like Green Hack, they have the big semis that come in, so they are cranking out, 3-4 tests at a time, and if they show a huge shift, then we will do their retest to make sure that there isn't significant, and then we'll fit them for like custom hearing protection and that type of stuff. Yeah.
What about the average homeowner mowing their lawn, things like that, suggestions?
Should be wearing